Based on all this information and knowledge, I devised this blockbuster technique for treating diabetes. According to our blockbuster technique, you need the constitutional remedy. You need specific anti-miasmatic remedies. You need anti-psoric, antipsychotic, antisyphilitic, anti-tubercular, anti-cancer miasm. You need pathology-specific remedies, like how we gave Chionanthus. You need mother tinctures as drainage remedies to help repair the damaged organs like the liver. And you also need biochemic tissue salts to bring about favorable changes at cellular level. You also need sarcodes like insulin as drainage remedies. So there are multiple remedies required. You cannot cure only with one or two remedies. This is something which Burnett says. Burnett says, a remedy based on totality of symptoms, which we call constitutional remedy, relieves the patient, but it does not remove the diathesis. It does not reverse the pathology when pathology is advanced. Functional things will become all right. Very rarely you will see a pathology also getting all right. Pathology-specific remedies can reverse the pathology, but they do not treat the diathesis. So there will always be a relapse. But anti-miasmatic remedies like nosodes help in getting rid of the diathesis as well as the pathology, because they are prescribed on the basis of diathesis and pathology. So we have to use pathology-specific remedies if you have to cure diabetes. The pathology of diabetes can be reversed only if the patient receives the homeopathic remedy, which has the power to cure diabetes. There are certain mother tinctures and certain decimal scale potencies which we can use as drainage remedies. These help in restoring the function and structure of the damaged organs, like the liver, like the pancreas, and help in detoxifying the system, thereby removing the blocks to cure. Example, the diabetes repertory lists arsenic, calimure, uranium, nitricum, vanadium, and chionanthus for liver pathology. As a rubric, diabetes with liver pathology. So you know one of these will be required, along with the constitutional remedy. Little bit more about insulin. Insulin stimulates liver to store glucose in the form of glycogen. When there is too much fat in the liver, like fatty liver, the liver does not respond to insulin. So how will it convert glucose to glycogen? This causes increase in blood glucose, thus stimulating more insulin production by pancreas, which contributes to insulin resistance, leading to type 2 diabetes. So we need drainage remedies to correct the fatty liver. Like we gave chionanthus to the patient I showed you today. We also need sarcodes as drainage remedies. Insulin 12x in insulin resistance diabetes to reduce the high levels of insulin. In type 1 diabetes, I use pancreatinum 3x because there the main problem is that the pancreas are at fault. There is a destruction of beta cells of pancreas. That is why there is no insulin. So pancreatinum 3x is a sarcode. It is used to stimulate the pancreas to secrete insulin. I also use cortisol 200 when diabetes is due to steroids. These are some sarcodes which are used. Same principle. Give the same toxic substance in potency. Biochemic tissue salts. The diabetes repertory has a chapter on the use of tissue salts in the treatment of diabetes, taken from the repertory of biochemic medicines by B. N. Mitra. Cure can be achieved only if we can bring about changes at the cellular level. And this job is done by biochemic tissue cells. Sugar in urine. This is the case from that biochemist repertory by B. N. Mitra. He says, in this case, there was sugar in urine, 20 grains to an ounce, complete cure in a month by the use of 1 dose of natrum sulf 6x in the morning and 1 dose of Caliphos 6x in the evening. This is what I use in all my patients. Natrum sulf 6x, 2 tablets in the morning. Caliphos 6x, 2 tablets at night. And in the afternoon, insulin and glucose. That's how the protocol was made. Diet and regimen is important. This all of you know. Lifestyle changes are a must. Healthy diet, exercise, healthy sleep. So the protocol for diabetes treatment is constitutional remedy, specific anti-miasmatics, pathology specifics, mother tinctures, biochemic tissue salts, and sarcodes. All are required if you have to cure this complex disease.